Okay, for the pulmonary embolism, there's a blockage of one or more branches of pulmonary artery by a thrombus, fat, air, or tumor tissue that traveled from another part of the body. So, may thrombus siya, clot, pwedeng fat, pwedeng air, pwedeng tumor na nag-travel sa katawan natin. It's a life-threatening condition that lead to impaired gas exchange, increased pulmonary vascular resistance, and right ventricular strain. So, most cases result from deep vein thrombosis or DVT. So, ang signs and symptoms natin ay dyspnea, tachypnea, hemoptysis, and pwede din tachycardia, hypertension, tsaka cyanosis. Collapse, and syncope or nahimatay. Syncope. Nahimatay. Anxiety, restlessness, senses of impending doom, o yung parang mahihimatay nga impending doom. Diaparesis, low-grade fever, low-grade lang. Then, diaparesis po, or yung nagpapawis yung kamay. Sa physical assessment natin kay patient, kaya siya may pulmonary embolism. Ang general appearance niya ay anxious, cyanotic, dahil nga kulang sa oxygen. Then, may rapid or shallow breathing. Sa palpation natin, weak yung pulse niya. Tapos, hypotension pala to. Mababa yung BP. Hypotension din, weak yung pulse niya, may hypotension. Tapos, pag pinerkas natin, may dullness kasi pwedeng possible sa pulmonary infusion. Sa auscultation naman natin, ang marinig natin ay yun nga, anxious, cyanotic, weak yung peripheral pulse. Sa auscultation natin, crackles yung marinig, may wheezes, saka diminish yung breath sounds niya. Merong signs of DVT or deep vein thrombosis. Ang makikita natin dyan ay may swelling, redness yan, tapos mainit, warmth, tapos tenderness sa calf. So, ang mga medical history niya, ang pwedeng risk factors is surgery, pwedeng orthopedic, pelvic surgery, orthopedic surgery, abdominal surgery, prolonged. Risk factors natin ay recent surgery, prolonged immobility sa bed or long travel, malignancy or cancer, paggamit ng oral contraceptives, pregnancy, hormone therapy, oral contraceptive or hormone therapy, pregnancy, obesity, and history of thrombotic events. Then, for the laboratory and diagnostics exams, you have ABG, arterial blood gas. Makikita dito may hypoxemia, tsaka hypocapnia. Mababa din pala yung carbon dioxide niya dahil sa hyperventilation. And respiratory acidosis. Sa D-dimer test naman, elevated yung clot degradation. Then, sa chest x-ray naman, makikita na pwedeng possible na may pleural effusion. Or, atelectasis. Sa ECG naman natin, pwedeng may right heart strain. Sa CT naman natin, CT pulmonary angiograph. Ito yung gold standard. Yung CT pulmonary angiograph or CTPA. Ito yung gold na standard para sa pulmonary embolism. CT pulmonary angiograph. Then, meron tayong titawag na ventilation and perfusion scan para ma-mismatch yung perfusion defect with preserved ventilation. Then, sa Doppler ultrasound naman, para ma-detect yung DVD source, yung tip brain thrombosis natin, sa lower extremities natin titignan. Then, mayroon tayong tatawag na echocardiogram. It detects the right ventricular strain, pulmonary hypertension din. Okay, sa pathophysiology natin, mayroon thrombus formation. Pwede often in the deep leg veins due to virtuous triad. Ang virtuous triad natin ay risk factor for thrombosis. So, after magkaroon ng thrombus formation, magkakaroon ng embolization, yung thrombus na yun ay magdi-dislodge, then travel siya through venous circulation to the right atrium and right ventricle. So, magsisirculate siya sa right ventricle and right atrium. Nagtravel siya dahil sa venous circulation. Then, after that traveling, meron ng pulmonary artery obstruction kasi nga nakabara na yung clot na yon. Embolus lodges in the pulmonary artery, reducing the blood flow. Hindi makakadaan ng blood na maayos. Then, dahil nga may pulmonary artery obstruction, magkakaroon ng ventilation and perfusion mismatch. So, ventilated alveoli not perfused, magkakaroon ng hypoxemia. Dahil nga may hypoxemia, it will also lead to increased pulmonary vascular resistance. Then, tataas ang hypertension natin, pulmonary hypertension. Sa right ventricle, magkakaroon ng strain or failure, right ventricular failure. Then, it will reduce left ventricular preload, magdidecrease yung cardiac output natin, magkakaroon ng hypotension, then shock. And sa severe cases, sudden death from the cardiovascular collapse. So, ganito nangyayari. Una, may clot. Thrombus formation, then embolization, pulmonary artery obstruction, pag nagkaroon ng pulmonary artery obstruction, magkakaroon ng ventilation and perfusion mismatch. After ng ventilation and perfusion mismatch, magkakaroon ng increased pulmonary vascular resistance. Then, magkakaroon ng hypotension muna, pulmonary hypertension, tataas muna yung pulmonary hypertension natin. Then, yung right ventricular, magkakaroon ng right ventricular failure. Then, pag nangyari yun, magdidecrease ang cardiac output. Pag nag-decrease ang cardiac output, magkakaroon ng hypotension na mababa na yung PP, and then mag-lead sa shock. So, ang medical management natin is oxygen therapy para makorek yung hypoxemia. Then, IV, access for fluids and medication. Pwede tayo magbigay ng anticoagulants para sa first line natin. Then, tulad ng warfarin, anticoagulants. Then, thrombolytics para maalis yung for massive pulmonary embolism with shock. And analgesics for chest pain. And for the surgical procedure, we can do embeloctectomy or pag-remove ng embolus, embeloctomy, catheter-directed thrombolysis, inferior vena cava filter to prevent future emboli from TVT when anticoagulation is conducted. Sa nursing management natin, syempre i-assess natin yung respiratory status, yung ABG, pulse oximetry, respiratory rate, assess for the hemodynamic status like BP, HA, and ECG, watch out for bleeding kapag naka-anticoagulants, kasi that is a risk factor for deep vein thrombosis. Then, the position natin is semi-Fowler or high Fowler's position. Oxygen natin, administered as ordered, then monitor for saturated. Ang medication natin dapat accurate, coagulant dosing lang. Then, we can give analgesic for pain. Then, for DVT prevention, we have to encourage like exercise. Kasi yan ay risk kapag hindi nagagalaw yung katawan natin. Early ambulation, post-surgery, compression devices, then bleeding percussion, avoid IM injections, and monitor for stool and urine for blood. Tingnan natin kung may blood yung urine or yung stool. So, sa patient education, syempre, medication adherence, bleeding percussion, bawal yung gumamit tayo ng soft brittle toothbrush. Gumamit din tayo ng electric razor kapag mag-ahit, and avoid contact sports. Monitor for signs of bleeding, yung black na stool, tsaka hematuria kung may dugo sa ihi, and epistaxis or nosebleeds. Sa lifestyle modification, syempre maintain natin health, yung maintain healthy weight, quit smoking, stay hydrated, avoid prolonged immobility, and take breaks during long travel, use compression stockings if at risk for TVT, then regular follow-up check-up.